Hello, my name is Dr. Danney Drewry, and I'm an internal medicine physician with the Iowa Clinic, and I'm talking to you today about Advance Directives. Advance Directives are extremely important. The first question is, what are Advance Directives? And they are legal documents that you sign, and they help outline what your medical wishes would be in the event that you're not able to make the decisions yourself. It also helps guide your family in times of need when they have to make medical decisions on your behalf. There are several documents or parts to advance directives. The first thing would be a medical power of attorney. The first thing to distinguish is the difference between a medical power of attorney and a financial power of attorney. They are two completely different things, and you need to make sure that you have one designated as a medical power of attorney. And what a medical power of attorney is somebody that you delegate to represent you and make your medical decisions when you're unable to voice these decisions or wishes yourself. It would be in the event that you were on life support, comatose, incapacitated in any way. When deciding on who to use for a medical power of attorney, you always want to sit down and have a conversation with that person and explain to them what your wishes are. And they also need to understand the responsibility that goes along with being somebody's medical power of attorney. This is a legal document, and oftentimes you need to incorporate the help of a lawyer to help with this document. The next part to advance directives is the living will. A living will gives direction to the physician whether to continue treatment, withdraw treatment in certain situations. It also helps guide your power of attorney what decisions that they should make during times that you're unable to make those decisions yourself. It is a legal document, and it encompasses things such as if you want life-sustaining measures or not, what types of treatments you would want. Some other forms that we have here in Iowa would be an IPost form. An IPost form is something that should be kept on hand, and they recommend that it actually be put on your refrigerator. It is a form that asks 4 questions. The first question being, in the event that your heart stops and you stop breathing, do you want resuscitation? After that, it asks questions regarding the types of care that you would want, if you would want artificial means of nutrition, and who you want to make your decisions. This is a document that is active only when signed by your healthcare provider. So this is something that you would want to have a discussion with your doctor, and at that time you would fill that form out, sign it, it would then become active. Next piece of documentation that is included in Advance Directives is something called 5 Wishes. 5 Wishes is actually a packet and is, as it's labeled, 5 Wishes. You go through and answer multiple questions about do you want things such as resuscitation, and also it becomes more specific to situations such as if your kidneys would fail, do you want dialysis? If you have cancer, do you want to be resuscitated, do you not? Things like that. So it's very specific. It also reinforces a lot of the other documents that you would have already done. So given that you have all of these documents in place, which would be your medical power of attorney, your living will, if you have an IPost filled out, and or a 5 Wishes packet, things that I would strongly suggest is that these get revisited at least every 2 years. Health situations change, family dynamics change. None of the forms or the documents are permanent. They can be changed, revoked as you wish. I hope this has made Advanced Directives a little clearer for you, and thank you very much.